In order to answer this question, we need to understand what are the things that make a lip aesthetically pleasing. And I think it's really four things. First, the length of the lip. And with that, we mean the distance between the nose and the bottom of the lip. And also with the idea that we need to have a bit of tooth show when the mouth is slightly open, because the absence of tooth show gives the impression of aging. The second characteristic is the amount of red show. How much proportion of the lip is red, is the kind of mucosa red. And the more red there is across the whole of the lip from corner to corner, the more voluptuous we call the lip, because it gives the impression of fullness. The third characteristic is a pout. And by the pout, what I mean is that gentle J shape, that when you look from the side profile, there's more fullness at the very bottom of the lip. And it's very different than the appearance that the fillers give the lip, which is more of a kind of, straight, ducky appearance. And then the fourth characteristic, which I think is what makes the lip very different than any other part of the body, is that the lip needs to be beautiful while moving. It needs to move naturally. And again, I think that fillers make the lip almost move like a seesaw, because they take away that elasticity in the movement of the lip. And so surgically, there were two described procedures. One, which is the most common, is the bullhorn. And the bullhorn really relies on the idea that if we shorten the skin on the outside of the lip, just underneath the nose, we will pull up the lip and turn it so that there's more red that shows. The problem that I have with the bullhorn is that, one, it leaves a permanent scar in the most obvious part of the lip, of the face, i.e. the triangle in the middle of our face. And so even when the scar is a good scar, it's still a permanent scar. The other issue is, regardless of what people say, it changes the shape of the nostrils. And if you look at a lot of the bullhorn pictures, there's a difference in the shape of the nostrils. And then the third is it only addresses the part of the lip that's underneath the nose. And so it gives a kind of central swooping effect of the lip. The Scarless lip lift, or the V to Y lip lift, is scarless because all of the incisions happen on the inner aspect of the lip, i.e. the inner surface, the part of the lip that's the inside of the mouth. And so none of the scars are ever visible. And rather than shorten the outside of the lip, what it does is it kind of pushes the inside and curls it out, increasing the amount of red show across the whole of the lip and bringing more of the volume towards the bottom of the lip, giving it that pout. And so you have a full, voluptuous, normal looking lip that, once the swelling is settled, moves in a kind of normal, ethereal way. It gives a subtle result. And so it doesn't give that kind of Instagram lip filler appearance, but actually a normal, unoperated on appearance of a full red lip. The suitable candidate is someone who is looking for an improvement in the amount of red show, an increase in the amount of red show for the lip. Someone who is looking to increase the volume of the lip, but does not want they want a subtle change and does not like the results that fillers give to the lip. If you can imagine the difference between the letter V and the letter Y. The letter V, the letter Y is a V that you've moved forward, and then you've closed behind it to give the stalk of a Y. And so what the method is that we move two V's on the inner aspect of the lip. We move them downwards, i.e. we move the tissues from the top where the nose is towards the bottom. And behind them, we close the tissues to form a Y. And that's why we call it V2Y. And what that does is it brings more tissues downwards, but it also lengthens the inside of the lip and forces it to curl out, showing more of the red of the lip and giving it more volume. The sutures that are used are all absorbable, and so within 7 to 10 days, all of them will fall out on their own. And because the inner aspect of the lip heals so well, there's rarely problems with the wound healing. Well, the most important difference between the two is the absence of a visible scar. All of the scars are hidden inside the mouth. The second difference is it addresses the whole of the lip rather than the central part that's underneath the nose. So the problem with the bullhorn is it changes, it pulls up the central part of the lip underneath the nose, whereas the V2I addresses the lip from corner to corner. Also, the V2I scarless lip lift does not change the shape of the nostrils, where I think the bullhorn does. What the bullhorn has as an advantage is the amount of swelling after the surgery is less in the bullhorn than it is in the V2I. I always warn my patients that there's a good week of really severe swelling in which they would feel uncomfortable. And a lot of them will either need to take time off work or be working from home because the swelling will be noticeable. So in terms of risks, it really is the prolonged swelling that you have with this surgery. So a week in which most people decide not to go into work because they're very noticeable. And then followed by that, another 4 to 6 weeks where the swelling continues to subside. It is not noticeable, but there's swelling. Patients also describe a kind of sense of tightness in the upper lip during that period, and that will take up to 3 to 6 months to completely disappear. But most patients don't find that problematic. A small group of patients find the tightness irritating, but it does not change the way they speak or the way they eat. The final results are visible between week 6 to week 10, and that's when all of the swelling should subside.